Right. Convening the Committee on Health, Human Services, and Homelessness, Tuesday, March 29th, 2022, 10 a.m. in conference room 329 for the purposes of hearing the following resolutions. We will be implementing a 2-minute timer per testifier in order to get through all of our testimony. If that's okay, please refrain from using any profanity and conduct yourself in a civil behavior. If you choose not to, we could remove you from the hearing room or the Zoom, and you may not be able to complete your testimony. All right, first up, we have HCR 9 HR 6, Office of the Auditor.
Yeah, good morning. My name is Les Kondo. I'm the state auditor. This is one of, I think, 6 resos and bills that the committee is hearing this morning that asked my office to do work. And I want to make a general comment first. We didn't submit testimony on a number of the resolutions because we can do that work. But just because we can doesn't mean that we have the capacity to do it. And I think that's something that I would ask the committee consider as it looks through all of these resolutions, that we only have so much resources in the office, staffing and otherwise, and without additional resources, which may include consultants, it's going to be very challenging for us. And frankly, I don't think we can do all of the work, even on this agenda, the 6 resos and bills, in addition to the other 20 or so that are still circulating throughout the legislature, both on the House side and the Senate side. With respect to this this concurrent resolution specifically, it's a pretty heavy ask. The bill, which is HB 249, it is proposing to mandate pretty extensive insurance coverage, which includes coverage for well woman preventive care costs, to screenings for STDs and other conditions, to counseling, to supplements, to abortion, and to voluntary sterilization. For us, my office, to do a social and financial impact of this insurance mandate or proposed mandate, it's going to tax my office considerably. So, as I said at the beginning, my request is, if the committee is going to consider passing any of these resolutions, that it prioritize which ones are the most important for the committee, and consider the limited resources my office has. And like I said earlier, frankly, we can't do them all. Anyway, I'm happy to answer questions, but thank you for entertaining my testimony.
Thank you. Next up, we have Planned Parenthood.
Good morning, Chair Yamane and members of the committee. My name is Rachel Kinsey, and I'm testifying today on behalf of Planned Parenthood Alliance Advocates. We strongly support House Concurrent Resolution 9, which takes a first step towards passing the Reproductive Health Equity Act, a critical bill to safeguard access to abortion, fortify ACA health benefits, and save money for people in Hawaii. All people, regardless of income, gender identity, or type of insurance, should have access to the full range of preventive sexual and reproductive health services with no out-of-pocket costs, especially as communities recover from COVID-19 and deal with high inflation. With the United States Supreme Court poised to overturn Roe v. Wade, many other states, including California, Washington, Colorado, and Oregon, have already passed legislation this session to ensure that nobody loses access to healthcare and the protections that they depend upon. Hawaii has a long history of advancing abortion rights and protecting access to the broad range of sexual and reproductive healthcare. HCR 9 is an opportunity to continue this legacy. HCR 9 will get us one step closer to eliminating all copays for abortion care, vasectomy, treatment to avoid HIV, and other critical services. Even with the ACA in place, 1 in 5 women with private insurance still pays some out-of-pocket costs for their contraceptive care, and 25% of women who are not using their preferred method say it's because they cannot afford it. This RIA resolution will help Hawaii look to the example of other states that have passed similar legislation fortifying the ACA in state law, learning from their experiences and better understanding the benefits and, importantly, cost savings of RIA. So thank you for your consideration and support of this important resolution.
Thank you. Next, we have Kaiser Permanente.
Hi, good morning, Chair, Vice Chair, committee members. I'm John Karamitsu for Kaiser Permanente. We'll start on a written testimony requesting additional clauses to be considered by the auditor. Thanks.
Thank you. And we have Rosalind Calderon.
Aloha. Thank you, Chair Yamane, Chair Tam, Vice Chair Tam, and members of the committee. My name is Rosalind Calderon. I'm the Regional Field Organizer for Planned Parenthood Alliance Advocates Hawaii. I strongly support this resolution as a young woman of color and a Planned Parenthood patient. All people deserve access to comprehensive, affordable health care, including people with low incomes. Out-of-pocket costs are a huge barrier for many people. Oftentimes, cost can be the deciding factor between seeking care or not and suffering. With the Supreme Court greenlighting a near total abortion ban in Texas and Idaho, and the impending demise of Roe v. Wade, our lawmakers should be doing everything in their power to fortify abortion access in our state. To echo Rachel, even here in Hawaii, where we proudly support the right to abortion, too many people do not have meaningful access to care because of these high out-of-pocket costs. Thank you for your time and the opportunity to testify.
Thank you. That is all that we have to testify. We have a number of individuals submitting testimony from Save Medicaid Hawaii, ACOG, comments from Hawaii Association of Planned Health, and support from the State Democratic Women's Caucus, Hawaii State Democratic Women's Caucus. Is there anyone else wishing to testify? Chair, do you have any questions? Seeing now, we're going to move on to our next item on the agenda, HCR 10, recognizing February 22nd as Self-Care Awareness Month. We do not have anyone signed up to testify, but we do have one written testimony in opposition. Is there anyone here wishing to testify? Share any questions? Moving on to HCR 23, HR 21, requesting the Legislative Reference Bureau to conduct a study analyzing the use and effectiveness of mobile application or other similar means to deliver government assistance. First, we do not have anyone signed up to testify on this measure as well. Is there anyone in the audience wishing to testify or on Zoom? Share any questions? Next up, we have HCR 28 requesting the auditor to assess the social and financial effects of mandatory health insurance coverage for fertility preservation procedures for certain persons who have been diagnosed with cancer and whose cancer or cancer treatment may adversely affect their fertility. First up, we have HMSA.
Good morning, Chair, Vice Chair. My name is Lindsay Garcia from HMSA. HMSA stands in support of the intent of this measure, offering comments. We would just like to offer these additional clauses as we believe it will help the auditor to further refine their study. Thank you.
Next up, we have Kaiser Permanente.
Good morning again, Chair and Vice Chair, committee members. Kaiser stands on its written testimony and support, but we do have strong concerns with the legal and ethical ramifications surrounding the cryopreservation issue. And we'd like to ask the auditor to consider our testimony to address those issues. Thank you.
Thank you. Next up, we have the Hawaii Society on Clinical Oncology. In support.
Morning, Chair, Vice Chair Blake Washer on behalf of the Hawaii Society of Clinical Oncology. We stand on our written testimony in support, and I'm available to answer any questions.
Thank you. That is all that we have here to testify. Is there anyone else wishing to testify on the measure before us? We do have testimony and support from the Alliance for Facility Preservation and a individual, Anna Ong. We also have comments from the Hawaii Association of Health Plans, and we have one individual in opposition. Chair, members, any questions? Seeing none, we will move on to our next item on the agenda, requesting the auditor to conduct a social and financial assessment of proposed mandatory health insurance coverage for early access breast cancer screening. First up, we have Dr. Martha Weedman in support. We have the Hawaii Medical Association in support.
Good morning, Vice Chair Tam, Chair Yamani. Good morning. HMA stands on its written testimony and we are available for any questions. Thank you.
Thank you. Next up, we have the Hawaii Society of Clinical Oncology.
Morning again, Chair, Vice Chair Blake O'Shore on behalf of the HSCO. We stand on our written testimony in support and I'm available for any questions.
Thank you. That is all that we have signed up to testify. Is there anyone wishing to testify on the measure before us? We do know that we have a number of individuals submitting testimony in support on the measure. Members, any questions? Seeing none, moving on to HCR 38, HR 33, requesting the auditor to conduct a performance audit on the Department of Health, Hawaii State Hospital, and Hawaii Information Portal. First up, we have the Office of the Auditor.
Good morning, Les Kondo. I'm the state auditor. We have some concerns about the proposed, the requested audit. I guess more specifically, I have concerns about the value of the audit. It's my understanding that the time and attendance portal, HIP, that it rolled out in 2019, maybe even 2020 for some departments. And we had a similar resolution on the Senate side about both DOH as well as Department of Public Safety. And I know there was testimony about how Department of Public Safety anyway had experienced growing pains as they implemented a new system after whatever number of decades of written payroll logs. And according to Director Max Otani, he believed that all of the DPS issues had been resolved. I didn't hear any testimony from the Department of Health or more specifically the state hospital, but I assume they experienced similar growing pains in terms of transitioning to a new system. And my hope is that those issues have been resolved. So I guess my point here is that in terms of an audit, we would look at issues with a system that probably is running more that has their policies and procedures in place to assess whether or not they're following those policies and procedures. And if there are issues, if they're not, and there are issues that we identify, we would try to identify the causes of why the policy or those issues are occurring. In this case, because the system is relatively new, I'm not sure that the value of an audit is there, and maybe it's more along the lines of the department or the state hospital getting its policies and procedures with ETS together so that they can avoid some of the issues that I see some of the testifiers are reporting in terms of their payroll. Anyway, thank you very much for the opportunity to testify. Happy to answer questions.
Thank you. That is all that we have signed up to testify. We do note that we have a number of individuals in support, including the Office of Enterprise Technology and Services and the Hawaii Government Employees Association. Is there anyone else in the audience wishing to testify? Members, any questions? Seeing none, we're going to move on to our next item on the agenda, HCR 58, HR 52, requesting the Department of Human Services to establish a one-year pilot program to provide a basic income to qualified adults who are verified victims of sex trafficking or who are female or sexual and gender minority individuals seeking to exit the sex trade. First up, we have the Department of Human Services.
Morning, Vice Chair Tam and Chair Yamane. This is Kathy Betts, Director for the Department of Human Services. We'll stand on our written testimony where we appreciate the intent and offer comments. Thank you.
Thank you. Next up, we have the Hawaii State Commission on the Status of Women.
Chair, Vice Chair, also stand on our testimony and support. Thank you.
Thank you. We do have a number of individuals in support, from Affirm to Nikki and Yi. Is there anyone else in the audience wishing to testify? Members, any questions? Seeing none, Vice Chair does have a question. My question is for the Department of Human Services. If we were to turn this into a working group or a study, could the department provide any legislation in time for next year, like the next legislative session, for the body to consider?
Sure, Vice Chair, we could do that. Happy to collaborate with the community.
Thank you so much.
You're welcome. Thank you.
That is all that I have. We're going to move on to HCR 59, HR 53, requesting the Department of Health to issue certificates of stillbirth. First up, we have the Department of Health.
Good morning, Chair, Vice Chair, members of the committee. Lauren Kim, the Department of Health, the Policy Director, and the Acting State Registrar. The department doesn't oppose issuing certificates of stillbirth. However, this resolution may not be necessary. We do need enabling statute, and we would support amendments to HRS with that have certain protocols in place, namely that certificates of stillbirth do not have any legal standing and then are commemorative only. And appropriation may be needed if we want to enable online ordering of certificates of stillbirth, but the cost would be very minimal. I've checked with other jurisdictions, and most states who offer certificates of stillbirth basically use a Microsoft Word template. So we do not oppose this. We have a good idea of what the costs are. If the committee wishes to save some time and effort, this resolution is not necessary, and we'd be happy to work with this committee and the legislature next year on enabling statute. Thank you, and I'm available for questions.
Thank you. That is all that we have signed up for to testify. Is there anyone else in the audience wishing to testify? We do note that we have testimony in support from Hawaii Family Forum and an individual. We do have comments from Planned Parenthood, Alliance of Advocates. Members, any questions? Seeing none, moving on to HCR 64, HR 58, requesting the Judiciary to conduct a study on the necessity of mandatory referrals to the Department of Human Services for investigation or intervention in all cases of alleged domestic abuse involving a family or household member who is a minor or incapacitated person. First up, we have the Department of Human Services. Director Betts.
Good morning, Chair Yamane and Chair members. I'm Eladine Olival. I am the Child Welfare Services Administrator, and we stand by the testimony that has been submitted and will be available for any questions.
Thank you. That is all that we have signed up to testify. Is there anyone in the audience wishing to testify or on Zoom? Seeing that we do have comments from the Judiciary, opposition from Hawaii Family Advocacy Team, and support from one individual. Members, any questions? Moving on to HCR 66, HR 60, requesting the Director of Health to establish a telehealth and telephonic services working group to address the complexity surrounding the appropriate use of telehealth and telephonic services by specialty care area and coverage of these services by health insurance. First up, we have the Department of Health.
Good morning, Lauren Kim again, Policy Director for DOH. The department supports the intent of this measure. We established telehealth as a priority in 2015. We had the legislature graciously appropriated resources for a full-time statewide telehealth coordinator in 2019. And we have a telehealth council that and a HUI that works on broadband and other issues to establish telehealth as a community standard of practice. However, this resolution zeroes in on reimbursement. So DOH playing a leadership role for this is questionable. This is about scope of practice and about reimbursement issues. We endorse the fact that there are modalities, that there are persons in our community for whom telephonic audio only mental health services are critical if you're homebound or have low digital literacy or all of the above. But again, this is more of a reimbursement and scope of practice issue, and we are unsure of the value DOH would bring to this working group. Thank you, and I'm available for questions.
Thank you. Next up, we have the Department of Commerce and Consumer Affairs. Dcca.
Good morning, Chair, Vice Chair, members of the committee. Alani Kioki, Licensing Administrator for the Professional and Vocational Licensing Division. The division will stand on its written testimony, providing comments. Thank you.
Thank you. Next up, we have the Insurance Division offering comments.
Good morning, Chair, Vice Chair, Ian Robertson for the DCCA Insurance Division. We stand on our written testimony offering comments on these resolutions. Thank you.
Thank you. Next up, we have Healthcare Associations of Hawaii.
Good morning, Chair, Vice Chair. Thank you for the opportunity to stand on our testimony in support. I will note that in our testimony, we do make the recommendation that an individual from the Healthcare Association of Hawaii sit on this particular working group in order to ensure that the post-acute care sector is represented. Thank you.
Thank you. Next up, we have HMSA.
Good morning, Chair, Vice Chair, and members. My name is Lindsay Garcia from HMSA. HMSA is in strong support of this resolution. We are a strong supporter of telehealth. We were, in fact, the first health plan in the nation to provide a telehealth platform, HMSA Online Care. As the technology and understanding of appropriate use of telehealth and telephonic services has changed and evolved over the years, since the creation of the original telehealth state statutes and regulations, we believe that the establishment of this working group is timely. Thank you for the opportunity to testify.
Thank you so much. Next up, we have the State Council of Developmental Disabilities and Support. Well, Chair, Vice Chair, we stand on written testimony in support. Thank you. Next up, we have Kylie, an individual in support.
Good morning, House members. My name is Kylie Swan. I'm standing in support on the House HCR 66 because I want the doctors to provide telehealth if the clients can't make it to in-person appointment due to personal reasons or other reasons that we have. Please let me know if you have any questions that you have, and thank you for allowing me to testify. Thank you.
Thank you. That is all that we have signed up to testify. Is there anyone else wishing to offer testimony on the HCR 66 HR 60? Seeing none, members, any questions? Moving on, we're gonna, next up we have HCR 69 HR 62, designating the month of September 2022 as Child Care Provider Appreciation Month. First up, we have Hawaii Children Action Network Speaks.
Aloha, Chair and Vice Chair. Kathleen Auger with Hawaii Children's Action Network Speaks. I'll stand on my written testimony in support, and we hope that the committee can support this well-deserved honor. Thank you.
Thank you. Next up, we have the State Council of Developmental Disabilities in support. We said our written testimony in support. Thank you. That is all that we have signed up to testify. Is there anyone else wishing to testify on HCR 69 and HR 62? Members, any questions? We do have a number of individuals in support on this measure. So moving on to HCR 86, HR 77, requesting the Office of the Auditor to conduct a performance audit on the Child Welfare Services branch of the Department of Human Services. First up, we have Department of Human Services in opposition.
Aloha and good morning, Chair Yamane, committee members. I'm Eladine Olivao, Child Welfare Services Branch Administrator. On behalf of the Department of Human Services, we stand by the testimony that has been submitted and will be available for any questions. Thank you.
Next up, thank you. Next up, we have Dara Carlin in support. That is all that we have signed up to testify. Is there anyone else wishing to testify on the measure before us? We do want to make note that we have a number of individuals in support, including the Waimanalo Neighborhood Board and another one in opposition of the Hawaii Family Advocacy Team. Members, any questions? Seeing none, moving on to our next item on the agenda, HCR 89, HR 83. Urging the Department of Health to employ the Team 6B contact tracing team as a permanent staff and hire other members from the Native Hawaiian and Pacific Islander communities in an effort to address the health inequities that exist and create better access to culturally relevant programs for Native Hawaiians and Pacific Islanders. First up, we have, Philios Berman. Sorry.
Uruman.
Uruman.
That's fine. Thank you very much. Good morning, Mr. Chair and the committee members. My name is Philios Uruman, and I'm from the beautiful island of Chuk. I was one of your students in your social work class. I am standing today in front of you to support this bill as our community greatly needed. Before the pandemic, actually, when our state was closed because of the pandemic, our community went through exponentially great issues that resulted in many issues with unemployment, with health equity. And we saw that the community was served through the help of Team 6B. So I'm here today to support this bill. Thank you.
Thank you. Members, we do have testimony from the Native Hawaiian Pacific Islander Hawaii COVID-19 Response and Recovery and Resilience Team and the Pacifica Empowerment Advancement Inc. and a number of individuals in support. Is there anyone else wishing to testify on the measure before us? Yes. And please state your name.
Good morning, Chair and Vice Chair and committee members. My name is Chantel Matangi. I'm here to testify in support of this bill. I am here as a private citizen and not as in my capacity as a DOH employee or subcontractor. So as the creator of Team 6B, I would like to talk about the importance and all of their successes. During the pandemic, we found that Native Hawaiians and Pacific Islanders were being overly affected by COVID-19. This is not new, but unfortunately, because the state was not prepared for this, we continued to suffer. We saw many positive cases, and we are also overly represented in deaths. In order to address this with the leadership among the Native Hawaiians and Pacific Islanders, they advocated with the Department of Health to create a team that was specific to these needs. The reason that this is needed is because the engagement has to be in language. If we do not understand, if our communities do not understand what is being said to them, how do we expect them to cooperate or to make decisions that are appropriate for them or their health needs? Along with this, we needed to be culturally mindful of what we were doing. These communities live in multi-generational homes. They are not like the hegemonic community. They are different. And because of these diversities, again, we needed to offer them resources that may not have been needed by other communities community members, such as food, housing, as well as social support services. This is important because this was not being done prior to our creation. The other thing that we were able to do as Team 6B is we were able to help with data disaggregation. This is important because when you use umbrella terms such as Asian or Pacific Islander, what is lost is the subset of those groups who are unfortunately being overrepresented. And when our team was created, Team 6B, we were able to call and we were able to say to people, are you Native Hawaiian or Pacific Islander? If you are Pacific Islander, what island are you from? This helped the Department of Health create strategies that were specific to those communities so we could do educational outreach in Samoan, Chuukese, Marshallese, Pohnpeian, Koshrayan. Now that the time has come, and I will make this quick, now that the time has come for us to move on as we are evolving from pandemic to endemic, it is important to note that this is not something that is a niche employee situation. This is something that needs to be continued into the future because what we saw in COVID-19 is representative in all of the diseases that we see, whether it be high blood pressure, diabetes, kidney disease, cancer. And that is why a team like this and the resources that they provide into these communities is important. So we kindly ask that you support this measure. We understand that it may not be easy, but we can either choose to move forward supporting the weakness that has been present, or we can support those successes that we have had.
Thank you.
Thank you.
Members, any questions? Seeing none, we're going to move on to our next item on the agenda, HCR 94 HR 88, requesting the Department of Health to examine issues and barriers to enforcement to reduce noise from two-stroke engines, mopeds, and small off-road engines, and make recommendations to the legislature regarding changes to statutes, rules, and other guidance needs to help reduce noise from these sources. First up, we have Mr. Ted Boland.
Thank you, Chair Yamane, Vice Chair Tam, and members of the committee. Ted Boland on behalf of the Climate Protectors Hawaii. Hawaii has a problem with noise pollution. Despite laws and rules that are intended to prevent it, there are enforcement problems in particular areas, particularly with regard to loud vehicles and leaf blowers, for example, and other small off-road engines that make excessive noise and need to be regulated in order to protect people. So this this resolution and concurrent resolution would ask the Department of Health to examine the issues and barriers to enforcement to reducing noise pollution and including possible incentives to quieter electric vehicles and equipment. So I kindly ask the committee to approve this concurrent resolution and resolution 94 and 88 respectively, and I'm available for any questions. Thank you very much for the opportunity to testify.
Thank you. Is there anyone else wishing to testify on the measure before us? Members, we do note that we have one individual in opposition. Members, any questions? Rep. Ward.
Yes, to the testifier, if he's still there.
Still here.
Okay, what is your common sense reason for this? I mean, I know the study is there to find out more scientifically what's going on, but what is your sense of why have we got so much noise, even though we got stuff on the books?
The problem is, thank you for your question, Representative Ward. The problem is that some types of equipment are really hard to regulate. Mopeds that are altered after market and then go roaring down the street at loud volume. It takes a complaint and police to observe it in order to eliminate the problem. So it's partly mobility is a problem, and with regard to leaf blowers, they move around too. So, you know, they're there one day and gone the next. It's a problem for the department, I think, to be able to regulate this with the staff that they have.
If you were HPD, what would you do?
I guess it's if I were HPD,
you're the enforcer.
Yeah. I would assign more people to it. I would have when there are complaints in a consistent area, I would stake out some and have officers there to enforce. I would also urge incentives to have quieter equipment so that gradually we can move off of this. But there is a problem of, with regard to vehicles, it's a problem of simple non-compliance with the law, where you are altering equipment after the fact. So it's really law breaking and should be enforced by the HPD. So thank you for the question.
Boistering HPD is well taken, even though right now, just for normal patrols, they're 200 to 300 officers short. It's very unfortunate. Thank you for your testimony. Thank you, Chair.
Thank you.
Thank you. Is there any members, are there any other questions? Seeing none, we're going to move on to HCR 117, HR 117, requesting the Department of Human Services to immediately cease intercepting Social Security payments for children in foster care. First up, we have Department of Human Services with comments.
Aloha and good morning, Chair Yamane, committee members. I'm Eladine Olivao, the branch administrator for Child Welfare Services. On behalf of the Department of Human Services, we stand by the testimony that has been submitted and will be available for any questions. Thank you.
Okay. Thank you. That is all that we have signed up to testify. Members, any questions? I do have a question for the Department of Human Services. So let's say if we were to stop intercepting the Social Security payments, where would does the department have adequate funds to care for the child out of their budget?
I do not believe we do. What that does is that benefits help to replenish the funds that we currently use to take care of the board payments for the children that we take into foster care.
All right, thank you. Next up, we have, that is all the individuals that we have willing to testify. We do have one individual in support. Members, any questions? Any other questions? Sorry. Seeing none, we're going to move on to HCR 122, HR 122, urging the State Commission on the Status of Women to work with the Domestic Violence Action Center, the Filipino Chamber of Commerce in Hawaii, and other Chamber of Commerces of Hawaii as appropriate to develop and implement an outreach program aimed at informing domestic violence victims of available resources for assistance. We have the Commission on the Status of Women.
Chair, Vice Chair, we support this measure, but first I want to apologize just for the extreme tardiness of our testimony. We support passing this out and we support the Filipino caucus, but if you're so inclined, I do want to flag some amendments that we are requesting to strengthen this resolution. After conferring with the community, it was clear that there's an interest in creating a formal task force, so we would be open to chairing and convening a task force. So we have provided amendments to create the task force to end the invisibility and abuse of Filipino women, which was suggested by community advocates. We would also like to add to the stakeholder list the Consulate General of the Philippines, DOH, the Hawaii Immigrant Justice Center located within legal aid, the legal clinic, and the Hawaii State Coalition Against Domestic Violence. We think that those would be important players to do this effectively. We also do suggest taking out the part about implementing an outreach program. Implementation would require, muscle and money that we don't have right now, unfortunately. So we're requesting that be deleted from the language, and that the outreach plan should target not just domestic violence victims, but the Filipino community at large, because unfortunately, victims are not the only ones who are predominantly Filipino, but also perpetrators of fatal domestic violence are disproportionately Filipino. So we want to target the whole community. And then lastly, extend the deadline to 2024. I know that was a bevy of requested amendments. So we appreciate your consideration of that. And regardless, would like to ask that you pass this out. So thank you so much.
Thank you. Moving, that is all that we have signed up to testify. Is there anyone willing to testify on HCR 122 and HR 122? Seeing none, members, any questions? Seeing none, moving on to HCR 137, HR 137, urging the Department of Human Services to establish or contract with a victim service provider to maintain an emergency shelter for children who are survivors of sex trafficking. First up, we have the Department of Human Services with comments.
Aloha and good morning, Chair Yamane and committee members. I'm Eladine Olival, the Branch Administrator for Child Welfare Services. On behalf of the Department of Human Services, we stand by our testimony that has been submitted and will be available for any questions. Thank you.
Thank you. Next up, we have Zi Xing Shang.
Okay. Dear Chair, Vice Chair, and members of the committee, my name is Zhi Shong, and I stand by my written testimony in support of HCR 137, and I'd like to offer comments. I'm a survivor of trafficking, and I'm familiar with the service providers, the DHS, and navigating resources. I'd like to commend those who drafted HCR 137. I look forward to the progress the legislature is moving towards in creating human trafficking policies. Creating policies for the establishment of well-developed and structured emergency services to be provided by an emergency shelter for minors is necessary. It should be considered for the DHS or a service provider's operations, staff training, services, and scope of work to be outlined by the legislature. This will ensure that service providers and their staff provide consistent and excellent care to the most vulnerable. If it is not outlined by the legislature, the standard of services will not be regulated. The parameters of how emergency staff should operate would not be outlined, and it could yield inconsistent results, inadequate care, unsatisfactory support, or a lack of services to be provided. The legislature could consider establishing medical guidelines to how DHS and its contracting service providers shall operate. This will ensure the medical treatment the victims will receive is the highest level of care and from healthcare professionals who have undergone stringent scrutiny regarding their ability to practice medical care. Anything less would not suffice. The burden and responsibility is upon the first respondents to determine, certify, and investigate an emergency situation involving a trafficking victim. If the existing structure of emergency respondents is not effective in addressing crisis intervention, behavioral health, and emergency trafficking situations, it proves the necessity of an emergency services trafficking team made up of crisis workers, social workers, healthcare personnel, advocates, and legal professionals. If currently no such emergency shelter exists for minor victims, one of the most vulnerable groups of our society is not being served. Therefore, this resolution is viable and necessary to enact efficient and effective health and human services policies in order to advance public health and social services for the most vulnerable. Thank you for the opportunity to testify.
Thank you. That is all that we have signed up to testify. Is there anyone else willing to testify? Members, any questions? Rep Ward.
The last testifier, if I may. I don't know if it was my ears or your mask. I wasn't clear. Did you say that you were a sex traffic survivor?
Yes.
How did you survive? If I may ask.
I was trafficked from the age of 18 to 25. And then
in Hawaii?
It was not in Hawaii,
okay.
But I am a resident of Hawaii. I've lived here since I was 6 and a half. And then when I was 18, I moved to California, where I was a trafficked victim until 25. So I studied in California. I worked in the industry in California, and I was a resident of California during that time. But then when I moved back at the age of 25, at the end of my work in the trafficking industry, I became a resident of Hawaii again.
But how did you get out? I mean, this is about having the opportunity to escape. You escaped on your own, or?
I did. It's not like the movie Taken, if that's what you're thinking of. Like I have to escape a situation. I worked at a venue and it solicits sex trafficking services.
So you were a free
to the
agent,
public.
so to speak. You were a free agent. You were not compelled. You were a free agent. You could come and go.
Well, I don't know if
Or,
Miss.
that might not be an appropriate question.
Okay, but the whole thing is sex trafficking and she escaped it. Maybe
I
some
can explain.
insight. So if there's no insights, I have no problem.
Rep Capella.
Okay, to insinuate that a trafficking survivor is only a free agent, I think is egregious. There are so many levels and layers of exploitation that are very, very painful for so many different survivors, especially adult survivors. But I do have a question specifically going back to this resolution. Oftentimes people will talk about, well, X organization just built a home for survivors. A long-term care facility is very different from an emergency shelter space. If you would have had an emergency shelter space when you were being exploited, would that have been something that helped lead to your escape or your exit from
Yes, if such
exploitation?
services existed and were like told to the girls. So when we worked at the club, there were advocacy groups who would try to escape us. I don't know if that's the term, or to lead us out of the industry, to lead us out of trafficking. But they didn't have advocacy groups that would go into the club and try to promote such a shelter or facility. And I've experienced experiences with the girls that I've worked with who needed emergency shelters, whether it be long-term care facilities or an emergency short-term care facility. Because a lot of, like, for example, I can think of one specific example, a girl who experienced domestic abuse. She was a trafficking victim. She was aggressively assaulted by her boyfriend, and she didn't have anywhere to go. She had to fly back home to her parents' house. So, I mean, and then she was like beaten up, and it was very cruel. And I mean, if there had been such a service, she could have gotten help and support from such a service. Yeah.
Thank you.
Okay. And also in my testimony, I speak of another specific situation in which the question could be answered. Yeah. Thank you.
Thank you. Members, any other questions? Now we can move on to HCR 139, HR 139, requesting the auditor to conduct an analysis regarding the scope of practice for advanced practice registered nurses and physician assistants. First up, we have the Office of the Auditor.
Good morning, Les Kondo. I'm the state auditor. This resolution is requesting that we analyze the scopes of practice for advanced practice registered nurses and physicians assistants. I think that probably is beyond our expertise, and we would need assistance from professionals that are familiar with both areas of practice. I also am aware, at least I understand, that both advanced practice registered nurses and physicians assistants are currently regulated by the Hawaii Medical Board for physicians assistants and the Board of Nursing for advanced practice registered nurses. So I would suggest, in terms of the scope of practices for both of those professions, that those boards would be better suited to be able to identify the scope of their practices and would be able to provide a more informed assessment rather than having my office do that, because I don't think we're qualified to do that. Anyway, thank you for the opportunity to testify. And one last comment. I think our real value is doing performance audits and not necessarily doing these types of evaluations or assessments. I think that's the value that we provide the legislatures, being able to assess how programs that the legislature establishes and funds, how they're performing. Anyway, thank you again for the opportunity to testify.
Thank you. Next up, we have Board of Nursing with comments.
Aloha, Chair, Vice Chair, and members of the committee. Chelsea Fukunaga, Executive Officer for the Board of Nursing. The board will stand on its written testimony offering comments. Thank you.
Thank you. Next up, we have the Hawaii State Center for Nursing with offering comments.
Good morning, Chair, Vice Chair. Thank you for providing the opportunity for the Hawaii State Center for Nursing to offer comments. I apologize for the length of my testimony. There's a long history and a concerted approach to ensuring that the review of other statutes that may not include APRNs are compared to the scope of practice as established in Chapter 457. And so I wanted to describe that for you and put it on record. I also want to note that in reviewing the testimony, I support the recommendations provided by the Board of Nursing. If you have any questions, I am available. Thank you very much.
Thank you. Next up, we have Healthcare Association of Hawaii offering comments.
Thank you, Chair. Thank you, Chair, Vice Chair. We will stand on our submitted comments on this resolution. Thank you.
Thank you. Next up, we have Hawaii Association of Professional Nurses.
Hello, Chair, Vice Chair, members of the Committee on Health, Human Services, and Homelessness. My name is Dr. Bradley Kuo. I'm the Legislative Chair of the Hawaii Association of Professional Nurses, and we stand on our written testimony in opposition of this resolution as written. And we appreciate the comments presented by the auditor earlier during testimony. I will be available for any questions. Thank you.
Thank you. That is all that we have signed up to testify. Is there anyone else wishing to testify on the measure before us? Members, any questions?
Chair.
Okay. Rep Ward.
Yes, thank you. The Board of Nursing, if you're there.
Hi.
Do the nurses have enough on their plate, or should we get this passed so we can give you more? In other words, how are you guys doing now, given that there's a bill that just gave you more, I think, positions of aid in dying, in abortions, etc. What more is missing that you sense should be effectuated by this resolution, if anything? Or you want to take some stuff off your plate?
It's not that we're trying to expand the scope of practice. It's more to, I think, to align statutes in other departments to, let me gather my thought.
Do you want to reduce it?
No, it's not reducing the scope. It's to better align, because we updated our statutes, and it was updated from 2009 to 2014, and it's basically, we're trying to get other departments to align more with our updates in our current practice statute. So we're already able, or the board of the nurse profession, APRN specifically, are already able to do those types of whatever is outlined in their scope of practice. So it's more to clarify language. It's in other, so for example, if there's like Department of Health, they have other things that might make it more available for APRNs to practice within. Excuse me, I'm gonna go off camera real quick. I have to look at something. Sorry.
Okay. We pause for a moment, Chair.
Yeah. You want to?
I mean, if this is her organization, can we give her a minute to, offline doesn't mean really much when we're having to vote on this particular measure. Chair.
I'm so sorry about that. So essentially, I'm so sorry. So essentially, it's not to expand the scope of practice. We already have that within our practice statutes right now. It's within the rules. It's clearly written, very straightforward. It's more that we're identifying outdated language in other departments' rules or statutes. And so the language that they might have in their statutes or rules might preclude APRNs currently from doing things that they've already been by law authorized to do. They are, the wording is,
So some departments are not, how would you say, in sync with what the
Yes,
statute is saying?
that's exactly what it is. It's
They have a
there might
variation.
be outdated statutes. Yeah. So it's more that we updated our statutes and our rules, but other departments have not yet done so. So there might be language that when it defines like what a practitioner is, or it might be physician specific, essentially,
really
and it
not-
might preclude an APRN. I'm
You're
sorry.
not really interested in the auditor doing this particular scope of practice analysis? To
Well,
say
it
what-
would be more to identify gaps and limitations that exist in providing care by APRNs, essentially.
I don't see that as be it further resolved, actually, but that's another issue. Thank you very much for your testimony.
Thank you.
Thank you, members. Any other questions? Seeing none, we're gonna move on to HCR 147, HR 147, requesting the Drug Enforcement Administration assist the Department of Health with obtaining a federal exemption for the state authorized use of cannabis in Hawaii. First up, we have Occupy Cannabis Consulting in support.
Good morning, Chair, Vice Chair, members of the committee. Thank you for the opportunity to testify in support of this measure. My name is Dr. Clifton Otto. I will stand on my written testimony, and I just wanted to highlight a small change that I'm proposing, basically just for accuracy that deals with the history behind this resolution. So anyway, thank you very much for considering this important measure, and I will be available for any questions. Aloha.
Thank you. Next up, we have Devon Ward.
Aloha, Chair Yamane, Vice Chair Tam, Representative Capella, Representative Ward. My name is Devon Ward. I'm Senior Legislative Counsel at the Marijuana Policy Project, the largest marijuana policy reform organization in the U.S. I'm also a resident of the state of Hawaii. I'm here to testify with some comments on HCR 147. It's a little bit perplexed about this resolution because while Title 21, specifically Section 1300 of the Code of Federal Regulations, does allow individual persons to apply for exemptions for registering with the Drug Enforcement Administration, none of the provisions in Title 21 apply to state or local governments. Moreover, the state of Hawaii is not engaged in the conduct prescribed in Title 21, specifically manufacturing, distribution, dispensing, importation, or exportation of cannabis or any other controlled substance. Hawaii, like 30 other states in the country, only licenses individuals and businesses to manufacture, distribute, dispense, and import cannabis. This approach is consistent with the authorization provided to states by the Rocha-Roa-Farr Amendment, which prohibits the DOJ from spending funds to interfere with the implementation of state medical cannabis laws. This has been the law of the land since 2014, adopted in every subsequent spending bill by Congress since then. And the Rocha-Roa Amendment became law, but the Department of Justice actually interpreted that amendment incorrectly. But even that interpretation allows state officials to be protected from prosecution by the DOJ. And some states, through their agents or entities, have never been the ire of the Department of Justice or DEA for their licensing of medical cannabis businesses. In 2016, the DOJ's interpretation was rejected by the Ninth Circuit Court of Appeals as well in separate cases, consolidating the appeals of 10 medical cannabis providers in states of California and Washington. And that unanimous ruling has become binding on 9 states in the Ninth Circuit, including Hawaii. Most recently, Joe Biden became the first president to propose a budget with the Rocha-Roa-Farr Amendment included. And Merrick Garland, our current Attorney General, has also said that they're not going to prosecute states for lawful medical cannabis use. I just think this resolution is unnecessary. The DOH has a ton of duties they have to do otherwise, and we'll recommend opposition to this resolution. Thank you for the time.
Thank you. That is all that we have signed up to testify. Members, any questions? Rep. Ward.
Dr. Otto, are you there?
Yes, I am, Representative
Dr.
Ward.
Otto, thank you for your persistence in pursuing this matter. I know as a constituent, you have tirelessly pursued protection of your medical marijuana applicants. If we pass this, will you and others live happily ever after? In other words, how much down the field are we really putting the ball, if I may?
Sure. Thank you for the question. I feel that this resolution is important because it follows up on the legislature's intent and will to do something about this unacceptable situation with federal conflict. And as you know, last session, both chambers of the legislature unanimously adopted HCR 132, which asks the Department of Health to file a federal exemption application with the DEA. We're still waiting on that action from the Department of Health. But in the meantime, I believe that this resolution allows the legislature to continue to express its will that this is something that needs to be addressed. Of course, it's not binding upon the DEA. It's simply making the DEA aware that this is an issue that the legislature wants to be addressed. And perhaps that would help the Department of Health feel more comfortable about opening up a dialogue with the DEA to allow some type of progress to be made.
Thank you for your testimony and persistence. Thank you, Chair.
Thank you very much.
Members, any other questions? Seeing none. We're going to move on to HCR 149, HR 149, requesting the adoption of a state policy assuring that savings realized by the state through the extension of federal medical assistance percentage payments of 100% for Native Hawaiian healthcare systems is used to address the health disparities experienced by the Hawaiian communities. First up, we have the Department of Human Services with comments.
Aloha, I'm Judy Moore Peterson, MedQuest Administrator with the Department of Human Services. And on behalf of the Department of Human Services, we stand on a written testimony, appreciating the intent and offering comments. Thank you. I'm available for any questions.
Thank you. Next up, we have Waianae Coast Comprehensive Health Center in support.
Aloha, this is Rich Bettini out in Waianae. We strongly support this resolution, and we are hoping that the benefit established by the federal government, basically to relieve the state of federal matching funds under Medicaid for Native Hawaiian health centers, is realized as soon as possible. And we do hope that the majority of the funds that are retrieved by the general fund can be allocated to remaining needs of Native Hawaiians and health disparities. Available for any questions. Thank you very much.
Thank you so much. That is all that we have signed up to testify. Is there anyone else willing to testify on the measure for us? Members, we do note that we have testimony and support from the Waimalalo Health Center as well. Members, any questions? Seeing none, we're going to move on to HCR 155, HR 155, urging the city and county of Honolulu and the Honolulu Police Department to address the ongoing houselessness crisis and develop solutions for providing care and services for these individuals while ensuring community safety. First up, we have Governor's Coordinator on Homelessness.
Good morning, Chair Yamana, Vice Chair Tam, and members of the committee. Scott Morishige, Governor's Coordinator on Homelessness and Chair of the Hawaii Interagency Council on Homelessness. I'll stand on my testimony offering written comments regarding how the City and County of Honolulu and Honolulu Police Department currently partner with my office and other state agencies to address the issue of homelessness island-wide. Thank you for the opportunity to testify.
Thank you. Next up, we have Austin Celeste.
Hello, Chair. And it's nice to see Representative Jean Ward there and Les Kondo. Lauren, maybe it's a question as far as to you, but I'll do it in support of HR 155 with amendments. 155 is actually incomplete and unachievable for HPD because there's manning shortfall. But we need to hold all caregivers who's giving all to the mental health in care of, and the facilities, including not limited to the psychiatrist, psychotic psychologist, mental health clinic and facilities, even to the private home that Department of Health had approved to be in our residential area as well. It's imperative that we have laws out there by the Board of Health, Department of Health, that puts the responsibility on the caregiver. But apparently we need accountability of the caregiver to be 24/7 for these individuals, in care of them, to give them a navigation or structuring. I have provided a testimony because 2 minutes is not enough to elaborate on all all the discussion that's covering the homelessness in our area. And no matter how much HONU program that they have, the resistance is the problem. And we need accountability of all these caregivers. Was there the mental health clinics? We have over a dozen of them on the west side. Okay, and they're majority, few of them, the clinics, the mental health clinics, are part-time. They shut the doors at 4:30. There's no navigation after that for the mentally ill or the substance abuse for them. So they're actually an influx of homelessness on our West Coast. I'm a resident on the West Coast, and we have a measurable.
Can you please wrap up your testimony?
It's only been a minute. And we have to actually streamline the Board of Health as far as locating real estate and offices for these clinics. And we need to set the policy roots on this thing on ground level to have it streamlined for 24 hours, 7 in navigation for this homelessness, because they're coming out of the clinics and into our parks. And it's an influx, and it's causing a lot of chaos because they're.
Can you please wrap up your testimony?
Okay, simply, I support the 155 with amendments, but we need policies on the state level as well. That concludes my testimony. I'm open for questions, please.
Thank you. That is all that we have signed up to testify. Anyone else wishing to testify on the measure before us? Members, any questions? Rep Ward.
Mr. Moshige, it's got the resol starts out with what I thought was untrue, but I wanted to ask you if that's the case. It says Hawaii has the highest in the nation of homelessness. Is that true? Or I thought we were 3 or 4 or 5. Where are we?
Thank you, Representative Ward. So as of the 2020 point in time count, Hawaii had the second highest rate of homelessness per capita among the 50 states. So District of Columbia, and then I think the state of New York, and then the state of Hawaii would be following that in terms of per capita rates of homelessness.
Per capita, yeah, that's probably the more accurate metric. So we're holding our own in the top 5. This is all about HPD. You said you work closely with HPD. I didn't see any testimony from HPD. Can you channel them and see what they think? Or what would you say they think of this result, being that they didn't testify?
I don't want to speak on behalf of the Honolulu Police Department, but I will know, my office works very closely with them as well as the city administration. We rely on the Honolulu Police Department community policing team to respond to concerns reported to us about homelessness. We partner with them to offer training to homeless service providers, and of course, they help to administer the HONU program on behalf of the city.
This resolution is asking for them to develop solutions, kind of like in your Kuleana, actually, and other sort of things that 3 strikes, and it just puts a lot of burden on the police department. So I'm wondering if they're conspicuously absent because they're not in agreement with this resolution. Thank you, Mr. Moshige. You got a tough job. Thank you, Chair.
Thank you. Members, any other question? Seeing none, we're going to recess and reconvene at 11:15 for decision making. Recess. reconvening the hearing on health, human services for the purposes of decision making. March 29th, 10 a.m. in room 329. Into my, sorry about that. Reconvening the Health, Human Services, and Homelessness Committee hearing March 29th, 2022, 10 a.m. in room 329 for the purposes of decision making. First up, we have HCR 9, HR 6. Vice Chair's recommendation is to pass HCR 9 with tech amendments and defer HCR 6. The reason why we're deferring.
HR 6, HCR.
Oh, we're gonna defer HR 6 and pass HR 9 with tech amendments. Concurrent resolutions are the ones that can call for us audit. Members, any questions or discussion? Seeing none, Chair for the vote.
Okay, Vice Chair recommendation is to move HCR 9 with amendments. Chair, Vice Chair voting aye. Rep. Gates. Aye. Rep. Har. Aye. Rep. Capella.
Aye.
Rep. Nishimoto.
Aye.
Rep. Ward.
Aye.
Okay, measure passes.
Thank you. Next up, we have HCR 10. Recommendation is to defer as February 2022 has passed, and resolutions are only good for 1 year. Next up, we have HCR 23 HR 21. Recommendation is to pass with amendments. We're going to request that the Office of Enterprise Technological Services work with the Legislative Reference Bureau to conduct the study. Members, any discussion? Seeing none, Chair for the vote.
Okay, recommendation, the Vice Chair is to move HCR 23 HR 21 with amendments. Anybody wishing to vote no? Anybody wishing to vote with reservations? Okay, seeing none, measure moves.
Next up, we have HCR 28. Recommendation is to pass as is, and we're going to note in the committee report the suggestions raised by HMSA and Kaiser. Any discussion? Chair for the vote.
Okay, recommendation of the Vice Chair is to move HCR 28 unamended. Anybody wishing to vote with reservations? Any noes? Seeing none.
Moving on to HCR 33, recommendation is to pass as is. Discussion, sorry. Seeing none, Chair for the vote.
Okay, recommendation of the Vice Chair is to move HCR 33 unamended. Anybody wishing to vote with reservations? Any noes? Seeing none, measure moves.
I forgot that I should be reading these out, so I'll start reading them. Moving on to HCR 38, HR 33, requesting the auditor to conduct a performance audit of the Department of Health, Hawaii State Hospital, and Hawaii Information Portal. Recommendation is to pass as is. Members, discussion? Seeing none. Chair, Chair for the vote.
Okay, members, recommendation of the Vice Chair is to move HCR 38, HR 33 unamended. Anybody wishing to vote with reservations? Any noes? Okay, seeing none.
Thank you. Next up, we have HCR 58, HR 52. Recommendation is to pass with amendments. We're going to change this resolution into a study that will be conducted by the Legislative Reference Bureau with the Department of Human Services, and request that the report be submitted to the legislature 20 working days prior to the convening of the legislative session of 2023. Members, discussion? If not, Chair for the vote.
Okay, members, recommendation of the Chair, Vice Chair is to move HCR 58, HR 52 with amendments. Anybody wishing to vote reservations? Any noes? Okay, seeing none.
Next up, we have HCR 59, HR 53, requesting the Department of Health to issue certificates of stillbirth. Recommendation is to defer as it asks for a appropriation and requires a statute. Moving on to HCR 64, HR 58, requesting the Judiciary to conduct a study on the necessity of mandatory referrals to the Department of Human Services for investigation or intervention in all cases of alleged domestic abuse involving a family or household member who is a minor or incapacitated person. Recommendation is to pass with amendments. We're gonna pass it with tech amendments. And in the committee report, we're going to make note of the judiciary's questions from their testimony. Members discussion? Seeing none, chair for the vote.
Okay, recommendation of the vice chair is to move HCR 64, HR 58 with amendments. Anybody wishing to vote reservations? Any noes? Seeing none, measure moves.
Moving on to HCR 66, HR 60, requesting the Director of Health to establish a telehealth and telephonic services working group to address the complexities surrounding the appropriate use of telehealth and telephonic services by specialty care area and coverage of these services by health insurance. Recommendation is to pass with amendments. We're going to do tech amendments, and we're going to remove DOH from the second be it resolved and put them in the fourth be it resolved so that they don't have any leadership in this working group because it really doesn't pertain to their expertise. Members discussion? Seeing none, chair for the vote.
Okay, vice chair recommends HCR 66 and HR 60 moving with amendments. Anybody wishing to vote with reservations? Any noes? Seeing none, measure moves.
Next up, we have HCR 69, HR 62, designating the month of September 2022 as Child Care Provider Appreciation Month. Recommendation is to pass as is. Members, any discussion? Seeing none, chair for the vote.
The recommendation of the chair is to move HCR 69 and HR 62 as is. Anybody wishing to vote with reservations? Any noes? Okay, seeing none, measure moves.
Voting on HCR 89, HR 77, requesting the Office of the Auditor to conduct a performance audit of the Child Welfare Services branch of the Department of Human Services. Recommendation is to pass as is. Members, any discussion? Seeing none, chair for the vote.
Okay, members, recommendation of the vice chair is to move HCR 86 and HR 77 as is, noting the support from chair, vice chair. Any reservations? Any noes? Okay, seeing none, measure moves.
Voting on HCR 89, HR 83, urging the Department of Health to employ the Team 6B contact tracing team as permanent staff and hire other members from the Native Hawaiian and Pacific Islander communities in an effort to address the health inequities that exist and create a better access to culturally relevant programs for Native Hawaiians and Pacific Islanders. We're going to pass this with amendments, simply just making tech amendments. Members discussion? Seeing none. Chair for the vote.
Okay, recommendation of vice chair is to move HCR 89, HR 83 with amendments. Anyone with reservations? Any noes? Okay, seeing none. Measure moves.
Moving on to HCR 94, HR 88, requesting the Department of Health to examine issues and barriers to enforcement to reduce noise from two-stroke engines, mopeds, and small off-road engines, and to make recommendations to the legislature regarding changes to statutes, rules, and other guidance needed to help reduce noise from these sources. The recommendation is to pass with amendments. We're going to remove the part where copies of the resolution will go to the Speaker and the Senate President, as they will be voting on the resolution anyway. And we're going to make tech amendments. Members, any discussion? Seeing none, chair for the vote.
Okay, a recommendation of vice chair is to move HCR 94, HR 88 with amendments. Any reservations? Any noes? Seeing none. Measure moves.
Moving on to HCR 117, HR 117. The recommendation is, requesting the Department of Human Services to immediately cease intercepting Social Security payments for children in foster care. The recommendation is to pass with amendments, simply making tech amendments. Members discussion? Seeing none, chair for the vote.
Okay, recommendation of vice chair is to move HCR 117, HR 117 with amendments. Any reservations? Any noes? Seeing none. Measure moves.
Moving on to HCR 122, HR 122, urging the State Commission on the Status of Women to work with the Domestic Violence Action Center, the Filipino Chamber of Commerce in Hawaii, and other Chamber of Commerce in Hawaii as appropriate to develop and implement an outreach program aimed at informing domestic violence victims of available resources for assistance. Recommendation is to pass with tech amendments. Members discussion? Seeing none, chair for the vote.
Okay, recommendation of the vice chair is to move HCR 122, HR 122 with amendments. Anybody with reservations? Any noes? Okay, seeing none.
Voting on HCR, I know. Next up, we have HCR 137, HR 137, urging the Department of Human Services to establish or contract with a victim services provider to maintain an emergency shelter for children who are survivors of sex trafficking. Recommendation is to pass with amendments, simply making tech amendments. Members discussion? Seeing none. Chair for the vote.
Recommendation of the Vice Chair is to move HCR 137, HR 137 with amendments. Anybody wishing to vote reservations? Any noes? Okay, seeing none, Vice Chair.
Thank you. Voting on HCR 139, HR 139, requesting the auditor to conduct an analysis regarding the scope of practice for advanced practice registered nurses and physician assistants. We're going to pass this with amendments. We're going to request that the DCCA conduct the analysis instead of the auditor. That was the main concern. And on page 2, we're going to remove other medical care and services as it may be a little too broad. And in the committee report, we're going to make note that the resolution is not going to seek to limit the scope of practice, but to expand, as some testifiers have expressed their concern over the possibility of limiting scope. Members, any discussion? Seeing none, Chair for the vote.
Okay, recommendation of the Vice Chair is to move HCR 139, HR 139 with amendments. Anybody wishing to vote with reservations? Any noes? Okay, seeing none, Measure moves.
Thank you. Next up, we have HCR 147, HR 147. The recommendation is to defer as there have been things in the works already. Okay, next up, we have HCR 149, HR 149, requesting the adoption of a state policy.
Excuse me, Jim, I didn't hear what you said on HCR 147.
Oh, yeah, that was the requesting that the Drug Enforcement Administration assists the Hawaii Department of Health with obtaining a federal exemption for the state authorized and use such. We're going to defer this as I think something's in the works already. Yeah. Moving on to HCR 149, HR 149, requesting the adoption of a state policy assuring that the savings realized by the state through the extension of the federal medical assistance percentage payments of 100% for Native Hawaiian healthcare systems is used to address the health disparity experienced by Hawaiian communities. We're going to pass this with amendments, simply making tech amendments. Members discussion? Seeing none, Chair for the vote.
The recommendation of the Vice Chair is to move HCR 149, HR 149 with amendments. Any reservations? Any noes? Okay, seeing none, Measure moves.
Last item on the agenda, we have HCR 155, HR 155, urging the city and county of Honolulu and the Honolulu Police Department to address the ongoing houselessness crisis and develop solutions for providing care and services for these individuals while ensuring community safety. The recommendation is to pass as is. Members, discussion? Seeing none, Chair for the vote.
Okay, recommendation is to move HCR 155, HR 155 as is. Any reservations? Any noes? Seeing none, Measure moves.
Hearing is adjourned. Thank you.